Hello everyone, welcome to the channel. In my last video, I have talked about our ureter. If you have not seen that video, then click on the button and watch the video now. Today, I'm going to talk about our urinary bladder. As you can see in this photo, it is a muscular reservoir organ. It remains inside our pelvic cavity. Inside our pelvic bone. Okay, just behind the symphysis pubis. That's it. You have to remember up to this much. Now, it has two phases. When there is no urine, when the urinary bladder is empty, and when it full or it has filled by urine. Okay, so it is made by very specialized muscle named detrusor muscle. Okay, and when it fills, it expands up to our umbilicus. Okay, now in size and shape there is two parts, when it is empty and when it is filled with urine. So when it is empty, the apex is pointed towards anteriorly, the base or the fundus pointed posteriorly. Okay, and the neck, it is the lowest and it is most fixed part, it doesn't move. Now it has four border. One is right lateral border, left lateral border, anterior border and posterior border. That's all. And it has three surface. One anterior surface, second right inferolateral surface, and third left inferolateral surface in flat position. That's it. And when it's filled, it looks like oval shaped organ. Okay, so the apex is pointed upward, upward towards the umbilicus. Neck is fixed, it's downward, and it has two surfaces. One is anterior surface and posterior surface. That's it. Now the relations. Okay, so in relation you will get few points. First point is our apex, and I will talk about our male and female. Okay, in female you will find cervical part of the uterus gone. In male you will find in apex upper part of the apex you will find rectum and rectovesical pouch. That's it. In the lower part of the apex you will find rectovesical fascia of denovilliers, then vas deferens and few seminal vesicles. That's it. And now the neck of the urinary bladder. In this point you have to remember that it is the most fixed part, as I already told you. So it remains 3 to 4 centimeter behind our symphysis pubis. Okay, and in female it will adjacently covered by the pelvic fascia. In male you will find periprosthetic part of the urethra, which is covered by few smooth muscle there. And the third point, our superior surface. In superior surface in female you will find our peritoneum, then vesicouterine pouch and isthmus part of the uterus. Okay, that's all. And in male you will find few coils of ileum, then peritoneum and sigmoid colon. That's all, nothing else. Now the fourth point is our inferolateral surface, right side, left side. In female you will find our libido muscle, obturator internus muscle and pubovesical ligaments. Okay, and in male you will find our obturator internus, libido muscle and puboprostatic ligament, because we male have prostate, female doesn't have prostate. Okay, all these points are when our urinary bladder is empty, it doesn't have urine. As time by time our urinary bladder is filled with urine. Okay, so and it extends up to our umbilicus. So at this point what happens, it shifts our peritoneum upward, and only the upper surface of the urinary bladder is covered by our peritoneum. Now one extra knowledge point, that this urinary bladder remains inside our pelvic cavity, not by any position. It gets hold or suspended by few ligaments. Okay, true ligaments, false ligaments, which are connected and it's hang. Okay, so you don't have to remember everything in details, but you have to know few names. Okay, names are important because this comes in MCQ based exams. Okay, as you can see in this photo, so the true ligaments are named like lateral true ligaments, lateral puboprostatic ligament, medial puboprostatic ligament, and in female, because female doesn't have prostate, so you will find pubovesical ligaments, then posterior ligament of the bladder and median umbilical ligament. Okay, and few false ligament. These are not actual ligament, but these are peritoneal folds. So you have to name like median umbilical fold, medial umbilical fold, lateral false ligament formed by our peritoneum of the perivesical fossa, and posterior false ligament formed by our peritoneum of sacrogenital folds. That's all. inner view of our urinary bladder, how it is looks like. Okay, suppose the urinary bladder is empty. Okay, so the inner part of the smooth muscle, what are the smooth muscles remaining inside, it gets folded. Okay, it gets folded like this, just like our stomach. As I told you, it looks like rugy appearance. That's it. And when it gets filled by urine, it gets all the muscles get stressed and it looks like very smooth. Okay, just like this. Okay, extremely smooth, no rugy, no muscle folds. Okay, that's all. As you can see in this photo, that inside of our urinary bladder there is a very very special area as trigone of bladder. It's a triangular appearance. Okay, so the apex is pointed directly to the downward and forward, where the internal urethral orifice you will find. I will talk about urethra later. And slightly upward you will find our right side and left side posterolateral angle of trigone. Okay, where our right side and left side ureter gets open. Now another special point is our capacity of our bladder. Okay, how much we can hold urine. Okay, in male and female, almost 200 ml is our normal capacity in adult body. Okay, so we don't feel anything. But after 200 ml, when it gets filled and continue get filled, we feel the desire of to go to urine. Okay, now I have to go to pee. Okay, so how this sensation works, what is the mechanism, I will talk in physiology chapter, not here. Now when the capacity goes beyond 500 ml, we feel extreme pain. Okay, it's very very painful. Now the blood supply has two components. One is arterial supply and venous drainage. In arterial supply you will find the main supply comes from our superior vesicular artery and inferior vesicular artery. Both are branch of our internal iliac artery. Okay, now the additional branches comes from our obturator branches, then inferior gluteal branches, also prostatic branches in male, and in female you will get direct branch from our uterine vesicles, uterine arteries, and few arteries from vagina. That's it, nothing else. And the venous drainage, you will get the vesicular venous plexus, which ultimately drains into our internal iliac vein. That's it. And now the nerve supply. Nerve supply has two components. One is sympathetic and parasympathetic. Sympathetic components comes from our 11th thoracic vertebra to the second lumbar vertebra, T11 to L2 finish. And the parasympathetic components comes from our S2, S3, S4 sacral plexus. That's it. So this is all about our urinary bladder. I hope you liked it. So our next video will be our urethra. Till then, bye.